I'm Dennis Culhane. I'm a professor of social policy at the University of Pennsylvania. Historically, in it's what we call contemporary homelessness, the period roughly 1980 to now, older adult elderly homelessness has been quite rare. In fact, the smallest portion of any group in the population by age has been people who are elderly. But starting in 1985, we observed something very profound, which is that the homelessness crisis that was emerging was dominated by people who were born in the second half of the baby boom generation, people born between 1955 and 1965. So in 1990, when we had the first national data, this group was between 25 and 35 years of age, with a peak age of 30. Okay, so they're quite young relative to the stereotypes at the time, which were that homelessness was mostly older adults, elderly, skid row men, for example, sleeping on the streets. And that actually was very far from the truth. It was dominated by young, mostly able-bodied young Black men and young Black women, and especially Black women with their children. And as time progressed, the population continued to get older. It's not the same people, okay? It's people who are in that same cohort, born between 55 and 65. So by 2000, their peak age was age 40. And by 2010, it had moved to age 50. And by 2020, their peak age is 60. So between 55 and 65 years of age. So you don't need to be a math major to know that their peak age now is moving towards 65, which is the official sort of elderly age level. But older adults who are homeless, who've had very hard lives, they've worked in very difficult, oftentimes menial, backbreaking work. Many of them have earlier onset disabilities than the typical population. So they look to be almost 15 years older than their chronological age. So even being 55 and homeless, very likely you could be considered to be aged. So yeah, we're seeing that the bulk of the largest group in the homeless population that's emerging is actually over the age of 55. I think that recent data is showing something around 30% of the adult homeless population is over 55. And this is something that was quite rare, as I said, in the past, and it's having a profound impact not only on people who experience homelessness, but the programs that serve them, and to the general public, and the hospitals, emergency rooms, nursing homes, etc. The aging homeless population is creating a lot of challenges, especially in the homeless service provider community. They are not used to dealing with people who are elderly, who have daily support needs that might accompany old age, and retrofitting these organizations to become more capable to serve this population is itself going to be a big challenge. And I think we really do have to question whether or not that is the right direction, or whether we should be much more insistent on getting people into housing where they could then access the kind of in-home supports that Medicaid and Medicare can provide for people who are in housing. Trying to do this in the shelter system, many of which, as you may know, many of these shelters are only open from 7 p.m. to 7 a.m., so people are out on the street. Half of the adult homeless population actually isn't even in a shelter. We don't have shelter beds. So obviously, we're not retrofitting in the street environment to be a place to provide these services. So I think that we really need to raise a flag, service providers included, to say, we're not ready for this. We can't do this. Don't try to make us become the safety net when we really need a genuine safety net for older adults, disabled adults, where people get appropriate services in a place like some kind of housing where they can take care of themselves as best they can. If we want to take this challenge on at scale, we can't be thinking about boutique programs that are going to serve 30, 40, or 50 people in a community, leaving hundreds unassisted. We can't think that just by retrofitting a few facilities that can handle older adults and their needs, that we're succeeding. We have to remember this is a population problem. It's affecting a large number of people, and our solution has to rise and meet that challenge. And that challenge is really a policy challenge. It's also a program challenge. So yes, we need to have HHS, HUD, other federal agencies commit to working on older adult homelessness, making income programs like SSI and SNAP easy, fast, and accessible, even creating emergency programs for people who are homeless, or emergency access for people who are homeless, so that they're not destitute and without any kind of cash. SSI could get folks about $1,000 a month, which would be game changing for a lot of people. So we have to work on that. That's going to involve also, we need programs in the community that are helping people to enroll in those programs. These are not easy programs to apply for or to navigate. So we need to partner with existing aging organizations, other eligibility and program enrollment programs, so that we're able to get folks into these programs as quickly as possible. It also goes to the issue of healthcare. Older people have increasing health needs. They may have all sorts of accommodations that are required because of their health conditions. So we have to make sure that our healthcare programs are reaching this population as well. Medicaid in particular is the program that's most important for this population. And so we have to make sure that our managed care companies that administer these Medicaid programs are paying attention to this population, that they're not ignoring them or only treating them when they show up at an emergency room or they're in the hospital, which is when they must take care of them. So we have to make sure that our insurance programs, our Medicaid programs, are actually funding the clinics and programs that can help this population get back into housing. Because Medicaid can be used in many states to help pay to get people back into housing, help them transition with some rent, with cash benefits, and supplementing that, as I say, as may be necessary. So I think that's the kind of direction we need to be going.